Thank you. Good morning, everyone. My name is Michael, and I'm delighted to present the findings of our most recent publication as a result of the RAIN study in the American Journal of Physiology. This work leverages the advanced cardiovascular magnetic resonance imaging, or cardiac MRI, that the RAIN study participants underwent to assess both for clinical and subclinical changes in young adults. Now, we know from experience in medical imaging that cardiac MRI is the gold standard method for evaluating cardiac structure and function. While it's less accessible than echocardiography, cardiac MRI provides more accurate and reproducible results, and this is why the RAIN study was such an important data set to us to provide us so many cardiac MRIs to work with. Furthermore, we know that hypertension during pregnancy, including preeclampsia, is a significant risk factor for future cardiovascular disease, both in the mother and in the offspring. And while some prior echo studies have suggested that adverse changes in cardiac structure and function were evident in newborns and in children, the results have been inconsistent. Long-term studies evaluating cardiac structure and function using cardiac MRI are a big gap in the literature, and so that's a gap that we aim to fill. We aim to determine if the offspring of hypertensive pregnancies showed adverse cardiovascular structural or functional changes detected by cardiac MRI and using feature tracking, segmentation and strain analysis in young adulthood. And so we analysed data from the RAIN study. And as you can see here from our patient induction flow chart, our final primary analysis included 867 members of the RAIN study who had undergone a cardiac MRI at age 27 years of age. And we also ran a secondary analysis among those who were born to hypertensive pregnancies between people born to hypertensive pregnancies in an isolated fashion and those with high-risk features such as preeclampsia or preterm delivery. We had a cohort of approximately 1/4 of patients born from hypertensive pregnancies. And in terms of risk profiles, we found that echoing those echo studies, both male and female offspring had higher blood pressures, significantly elevated in the hypertensive cohort as opposed to the normotensive cohort, while men also had higher diastolic pressures and women had increased BMIs and waist circumferences. And then when it came to the primary analysis of the MRI findings, we didn't find any significant changes in segmentation and strain for the left ventricle. In hypertensive pregnancies, we started to see evidence of a hyperdynamic right ventricular state, but nothing too conclusive. And in secondary analysis, we found that female offspring of the complicated hypertensive pregnancies had a lower left ventricular mass index than just the purely hypertensive cohort, which came as a bit of a surprise to us considering what we know so far. And I just draw your attention to the top left corner there. We can see the females having the significantly different, or significantly lower left ventricular mass index. And in conclusion, the treasure trove of information that was provided by the participants of the RAIN study have allowed us to conduct the largest cardiac MRI study that assesses clinical and subclinical cardiac changes in offspring of hypertensive pregnancies. So it's a massive privilege to be involved in this process and for the dedication and the sacrifice that the participants of the RAIN study have provided us all. Hypertensive pregnancy was not associated with adverse changes in cardiac structure and function in these offspring assessed by cardiac MRI, but the fact that we see increased cardiovascular risk factors with no significant corresponding structural change indicates that this could be a multifactorial problem such as epigenetic and lifestyle factors. And now I welcome your questions.